Welcome back to The Heat. The United Nations is urging the international community to send medical supplies and personnel to West Africa to fight the deadly Ebola outbreak. Joining us now from California is Ted Alemayhu. He's the founder and executive chairman of the U.S. Doctors for Africa. And here in the studio is Colonel Thomas Dempsey. He's an assistant professor and academic chair at the Africa Center for Strategic Studies. Gentlemen, welcome to both of you.
Sure.
Let's start with Ted in California. Ted, what are you hearing about the situation on the ground in West Africa?
Right. So what we're hearing is a couple of things. One is that the governments of the countries that unfortunately have been exposed to this virus are trying to do what they could and try to control it with whatever resources that they have. Unfortunately, the situation is getting a little bit dangerous, meaning that more people apparently are being exposed to the virus. And they're also crying out for international support.
This is being called, Professor Dempsey, an international threat. And as we just heard there, the situation is getting even more dangerous. Is there sufficient monitoring systems in place for us to see how this disease is spreading, where it's going?
No, I think that's one of the problems here. And unfortunately, this outbreak occurred in an area where you see some of the weakest health infrastructure on the continent. Normal diseases like malaria are really problematic in these areas. Some of them are remote, and it's not just the remote rural areas. It's these vast sort of shanty towns that have sprung up around the major cities, which have overwhelmed the ability of these cities to provide services, security, basic needs. So this makes for an area where I guess you could say it's a nice home for Ebola. It makes it a very, very difficult environment to get the resources there, to identify those who are suffering or being exposed to the disease, to provide adequate treatment, and to provide sufficient public information all the way down to the community individual level about the disease itself.
Right. Ted, in addition to, of course, the medical challenges that Ebola is posing to people in the area there, we're hearing of other problems right now, that hospitals are empty right now. People are actually leaving the hospital. And we've just heard in the past few hours that there's been violence in Liberia because people who've been quarantined, who've been basically cordoned off in parts of the country, are actually fighting with those who are quarantining them and trying to get out. So I guess this is just aggravating the problem all the time, isn't it?
Oh, without a doubt. So here's what we know so far, right? So we know that there are about 4 or 5 countries are affected by this virus, right? That's Nigeria, Guinea, Liberia, and Sierra Leone. And we also know that over 2,000 people have been affected, and over 12 or 1,300 people actually dead. So the question becomes, so we have identified the issue, and what are we going to do about this particular situation? Liberia is a perfect example. So you have a town where a certain clinic was in place. These patients who have been affected by the virus were actually securely kept by the government. And then you have the community is outraged by that particular circumstances, and they go out and obviously ransack the place, and the patients are dispersed in different places. Now, that's a remedy for a perfect disaster, right? So in this case, so what are we, or what is the international community is going to do to assist the government of Liberia? Now, this is not only a Liberia issue. This is going to be obviously continent-wide with absolutely no doubt. And then, of course, it becomes an internationally scary moment. So it's good that we know that the situation is there. We have to put as much resources as possible on the ground to assist the government of Liberia, the government of Sierra Leone, Nigeria, and Guinea. And I know some African countries already rallying behind these countries to provide whatever support that they could provide. So, let me tell you what we are trying to do here from the U.S. Doctors for Africa perspective. We are calling on the Congressional Summit on Ebola virus. The U.S. government has always been in the forefront, and then the situation such as this, talk about HIV/AIDS, malaria, and TB, and what have you, Now this thing just sneak out of nowhere and becoming a massive danger on the continent. So we're calling on some members of the Congress in Washington to join us on this very urgent congressional summit on Ebola.
Okay. Professor Dempsey, what about access in these areas? They're very remote areas. It's not crisscrossed by 6-lane highways all over the place, nor do we have other kinds of good communications like airports. How do people actually get into these remote areas? I mean, is there a role here perhaps for the military, which is perhaps the best resource in many of these countries?
I think yes and no. Yes, there is, I think, and I think a military response is going to be required. I do not think that Ted is being an alarmist. The longer this goes out of control, and it's clearly out of control right now, the more dangerous it becomes and the bigger the threat becomes, and the more difficult it becomes to sort of contain it and roll it back. These areas, they have few roads. Most of the roads are impassable during the rainy season. These are extremely remote. Communications are poor. So just the physical effort to move people and material into the affected communities is well beyond the capabilities, certainly of Liberia, and I would argue very, very quickly reaching the point that it's beyond the capabilities of both Sierra Leoneans and the Guineans. So yes, they are going to need outside assistance. They're going to need a great deal of it. The longer it takes to marshal that assistance and begin moving it into place, the bigger this problem is going to become.
Right. Ted,
Absolutely.
when we had the outbreak in Uganda, the health community was able to stop that outbreak at that time. What makes this outbreak so different, and why are these challenges so much more difficult?
You know, that's a very, very important question. Quite frankly, the answer is still to be known. But one thing we know for sure is that this is becoming a massive problem in that particular area, those 4 countries in particular. And then other countries throughout Africa are, of course, understandably being very, very cautious, and some of them are actually canceling flights and even travel to those countries. It's unfortunate, but you know, everybody gets nervous, understandably. So we always say that, you know, for every major challenge, there's also a great opportunity. And now, what is the opportunity here? Number one, the global community is talking about this issue. Number two, what is the infrastructure on the ground to be able to deliver the necessary care to those who've been affected and to provide some kind of very, very strong preventive measures? You know, the professor is absolutely accurate. It's very, very, you know, obviously the situation on the ground and the road system and what have you could be a challenge, but it's also the perfect opportunity for the African Union to rethink or to re-strategize is a different approach, such as maybe forming the African CDC, and it's been approved by member states apparently, and obviously the congratulations to the chairperson of the African Union Commission, Dr. Zuma, and the Ethiopian government actually pushed this forward. So the international community needs to rally behind this Africa CDC and provide them with the necessary expertise, resources, and what have you, so that next time we run into this sort of virus or a massively dangerous situation, then Africa is able to actually contain it with a very strategic support from outside.
Professor Thomas Dempsey, Ted Alemayhu in California, thanks to both of you for joining us.